Thank you for joining us today, and I'm excited to share with you for the next few minutes about one of ACP's newest technologies of the OmniFlow breathing therapy biofeedback system. As you see pictured here, and as I'm going to walk us through during demonstration for the next few moments, this is our virtual reality breathing exercise program that consists of our airflow sensor and our touchscreen laptop. The airflow sensor is plugged in via USB port to the laptop so that as the patient's completing inspiration and expiration exercises, the data is collected and transmitted onto the software so that on the screen, the clinician and the patient can simultaneously view how the patient's completing an exercise, what the target level is, and if they're achieving that target level. The clinician's able to go in and, as you'll see in a few moments, manipulate these parameters to find the right therapeutic threshold for that patient, and also to provide engaging exercises, as you see pictured here, such as our diamond mine, to keep that patient participating and understanding if they are reaching their goals. This can be for deep inhalation, forced expiratory volume, and rhythmical breathing to combine both inhalation and exhalation. And at the end, as you see featured here, and as we'll talk about during our demo, the clinician and the patient will receive outcome data that can be helpful to review with the patient so that they know where they are in their plan of care and in their progress. In addition, that clinician is able to document these outcome measures to be maybe more objective than what we would have in our documentation without the use of biofeedback. Two things that really stand out that make the OmniFlow breathing therapy system different is the fact that it does have this biofeedback capability in conjunction with the fact that it's a virtual reality animation feedback. Also, the fact that we can use both inhalation and exhalation exercises, while many tools out there will only allow you to focus on one or the other. We know from decades of research that biofeedback is very helpful in motor learning, and that's no exception with breathing therapy. We see, especially in studies that use virtual reality biofeedback, that those patients participate at higher levels and in higher intensity in their therapy sessions, helping them to achieve their outcomes quicker.
I'm going to begin today with our demo showing the diamond mine, or our deep inhalation exercise. This is used to improve inspiratory muscle power and inspiratory vital capacity. We're going to instruct the patient to breathe in slow and steady. As the patient attempts to breathe in a preset air volume in one breath, the inhalation is displayed as a vacuum cleaner collecting jewels and coins. A large diamond is collected for reaching the very far end target. This deep inhalation may facilitate improved diaphragmatic breathing, improved lung elasticity and volume, leading to increased muscle endurance required for proper function, self-care, respiratory swallowing coordination, and sustained speech production of words and phrases. As you see here, we have preset levels of easy, moderate, and hard, or we can customize. The challenge levels increase with the volume, how much air is expected, in this case, to be inhaled. We have the same option though for our exhalation exercises. Additionally, how many repetitions and how many sets of repetitions increases the challenge. Not shown today is a pre-exercise warm-up the patient can complete to get these specific target values. They range from 1 to 25. We can also go in and customize for any of our exercises or edit parameters to go through and adjust some of these parameters such as volume, flow, number of sets, number of repetitions, and rest period between repetitions. For our purposes today, I'm going to select easy. So we do get feedback automatically for our percentage. And this is an example of getting all of the coins and jewels in one breath. We'll do that again. Now, if I were to not have enough volume or were to not have a good lip seal over the mouthpiece, it may look more like this. Right, it kind of times out and it shows that we just got right over 50% of accuracy that time. That percentage is great for our patients to see, but we also get more objective outcome data here that our clinicians can use for their documentation. So we can see the best inspiratory volume level, also the average inspiratory volume level. We also can see this per breath or per repetition for the volume and flow levels. And then our loops, our flow volume loops, where across the x-axis we have our volume and across the y-axis we have our flow. And we can see with breath 1 and 2, where I completed this very timely in one breath with a good amount of air, that it stretches pretty far across the x-axis, it goes pretty deep on the y-axis, versus breath 3, where we have that deep, but we don't have the full air here. We don't have the full volume, and so it does not stretch across the x-axis very far. This is something that the clinician can use as a teaching point for the patient. Now I'm going to show you our prehistoric contest for forced expiration, and this is to improve expiratory muscle power. We would instruct the patient to take a deep breath and exhale as hard and as fast as you can. As the patient attempts to breathe out a preset air volume, again in one breath, the exhalation is displayed as a prehistoric javelin being thrown. The more forceful the exhalation, the farther the javelin travels, and the larger the size of the prehistoric animal that's rewarded as a prize. If the preset target value is exceeded, a mammoth is the reward. This forced expiration exercise can help with airway protection during swallowing, coughing, clearing the airway, and execution of adequate vocal intensity and phonation. We see again here that we have an easy, moderate, and hard preset level, or we can customize. This exercise is essentially an FEV1, or forced expiratory volume over 1 second. We'll go to our moderate level this time. Okay, so an example of getting to the farthest target and getting the woolly mammoth. We'll try that again. Okay, so this time I'll provide an example of not giving enough exhalation volume. Okay, so similarly to our diamond mine, we get the best expiratory flow and average expiratory flow here for the clinician to document and to show to the patient. Also the outcomes for repetition and our loops. So we can see the first couple of breaths had these nice, big, full loops, and that's what we would want our patient to shoot for. Now I'm going to go into our sail away exercise, which is similar to our prehistoric contest, but this is more about controlled expiratory volume and flow. Instead of one quick blast of air, we're going to sustain that duration. We're going to have the patient to be represented as a cloud. As the patient attempts to breathe out a preset air volume, the exhalation is displayed as wind moving the sailboat forward across the water. The patient must control expiratory volume and flow in this case, not just flow. Once patient reaches 100% of the target volume, the boat's going to arrive at a grassy island. For this exercise, it can help with expelling carbon dioxide, reducing dyspnea, helping to have a calming effect for those with anxiety and pain. It can improve eccentric control of the diaphragm to slow the pace of breathing and also retrain sustained phonation, vocal intensity, and speech intelligibility. Again, we have our preset thresholds here. I'm going to go with our easy to showcase this today. An example of getting to the target. You probably see right below the cloud there is this kind of air meter where it shows if I have too much air, it's going to turn red and it's going to be at the end of this meter. If I'm keeping it slow and steady, it will go to about the middle and in the green to yellow. And if I don't have enough, it will be at the very beginning. You'll see some of that. I'll try another good one here. Okay, stayed in the green. Now let's say that I provide too forceful of an exhalation. It goes to the end, you get that exclamation mark, and it also breaks the sail, as you see here. First is if maybe I don't have enough volume. Okay, we only got to the 25% buoy there. Now we get this outcome measurement. It's a little bit different from some of the ones we've seen previously. We can see how many times the patient achieved the goal. We had 5 repetitions. Out of that, there were 3 times that it was achieved. We also get a percentage, 72% of the time the target volume out of 5 attempts was achieved. Had 1 time that we exhaled too hard and 1 time that it was too low with the volume. Similarly, though, we still get these outcome measurements that our clinician can use for exhalation. I'm going to take us to Starry Road now. For this particular exercise, it is very unique in the fact that it combines both inhalation and exhalation for our rhythmical breathing. As the patient breathes in, the figurine in the picture is going to move up this Starry Road path, and as they breathe out, she's going to move down. Again, we have these preset levels of easy, moderate, and hard, but additional to being able to change the target volume level, we also can change the duration, the timing for the inhalation and exhalation. That is going to make a difference for our path slope. So how steep the slope is going to be determined upon this duration. The steeper the slope, the easier, because less time that's required for inhalation and exhalation. And the more gentle the slope, the harder. And we can customize to change maybe just inhalation or just exhalation. Again, this can be great for expelling carbon dioxide. It can be great for working on respiratory swallow coordination, and it can be great for reducing overall anxiety and pain. So again, the goal is to breathe in very steadily so that we stay on this path. But if I have very shallow breathing, maybe just kind of that blast of air in and out without having good control, it may look like this. Right, so we're not able to stay on the path and we're not getting as much of the stars. And that will provide an actual percentage of conformity for how well we stayed on the path. We see that in the upper right-hand corner. We also see it here and in our outcome measures. So here's that percentage. I started really well. I was at 100% for a while, and then I purposefully showed you what it may look like if the patient gets off the path. So we're at 82% accuracy. Something that is unique about this particular exercise is that it's an adaptive pathway. So if the patient does score to 90% or above, actually increases the challenge for how much duration is required, versus if they don't even get to a 60% accuracy, it will decrease that challenge for the patient. And just to show you the loops very briefly, here we can see both the inhalation and exhalation. So it's on the positive and negative side of the graph. Breath 1, 2, and 3 look very good, very symmetrical, low to the x-axis, versus at 4 and 5, where it's just, again, that shallow, quick breath of air. Lastly, I'm going to show you our dandelion exercise. This is our active cycles of breathing therapy that is going to go through proper breathing technique, thoracic expansion, and our huff technique. Again, this can be great for helping to protect the airway, helping to expel foreign objects, phlegm, secretions from the airway with that huff technique. And as the patient is going through each of these 3 active cycles of breathing, they can choose to move forward or backwards to repeat any of the portions of this exercise. And their breathing will be represented by this dandelion, and we'll talk about what that looks like as we go through. It's on the breathing control, really working at the level of good diaphragmatic breathing. And as you see, we're just going to simply breathe in and out gently for 10 to 20 seconds. This does not time out, though, so you can have your patient complete this for longer. And we're just going to see the dandelion sway back and forth. So if I'm having proper breathing back and forth, it's going to move accordingly, versus if I'm doing this, again, with those shallow breaths. Right, it's not really going to bend the dandelion back and forth completely, and we do want to see that flexion. So that could be a teaching point for your patient. Now to advance, I just go to the bottom right-hand corner to start thoracic expansion, and as we can see here, we're going to ask the patient to take a deep breath in, hold that inspiratory volume for about 2 to 3 seconds, and then breathe out slowly and steadily for 3 times. So we'll try that. Similar look here, but there's more focus on really having the patient have sustained expiration. Now, again, if the patient didn't get good inhalation or expiration, it may look a little different. Right, we don't see the dandelion completely flex, right? It kind of stops midline. And this is what would happen if the patient was not completely releasing that carbon dioxide, not having a good, full, sustained exhalation. Now we can look at our huff technique. We do get 3 repetitions for this. And the goal would be for the patient to breathe in deeply and to huff into the airflow sensor. There is a button here that if the patient coughs instead, that we can throw that trial out and restart. But if I am successful, we will see the seeds of the dandelion disperse from the stem. Okay, we got that one. Okay, an example of where we did not do a proper huff technique, it did not release. And here we're able to have new growth because we had, proper spreading of the seeds with the dandelion. Again, we're going to see outcome measurements really based on just the expiratory flow level. So this is picked up from the huff technique, and we can go through and see all of the information, including our flow volume loops.